Hashtag IED is real. Intermittent explosive disorder is a mental health condition that affects a person's impulsivity and anger management ability. It is characterized as frequent anger outbursts of aggression. Episodes can be triggered by almost anything and are most likely thrown out of proportion to the situation, and people categorize them as temper tantrums or violent acts of aggression. However, outside of these, they may show entirely appropriate normal behavior. The overall target audience we wish to reach with this campaign is anyone from a younger generation who may suffer from this condition, know someone who is, or is simply interested in the topic. Because of this condition's violent and aggressive implications and the lack of public information, a lot of social and self-stigma exists, which can prevent people from seeking the help they need. Therefore, many cases go undiagnosed, making them more likely to experience risks such as constant aggression, deterioration in relationships, abuse of substances, and self-aggression, which can be detrimental to them and the people around them. This initiative aims to reduce social stigma by spreading information to help people find the needed help. Like any other chronic disorder, IED can find its roots in many ways, from genetics to heavy trauma. One can be born with this condition, passed down from parents to children, or developed after experiencing a series of traumatic events either during childhood or adulthood. Being aware of its origins can be highly beneficial for someone who may suspect suffering from it or knowing anyone who does, and it can inspire them to seek a professional opinion about it. According to recent studies, the disorder only affects approximately 3% to 7% of the population. Since this disorder is not very common, it is an issue for many to identify if they experience IED or an anger management issue. A way for the public to know if they or someone they know suffers from this disorder is to be informed about its more common symptoms, such as chest pain, tremors, sight, palpitations, racing thoughts, anger and hostility, emotional dysregulation, alexithymia, general adaptive and maladaptive rumination, affective anger rumination, and impulsivity. Unlike what some may think, IED is not just a simple issue that people can control or just take anger management classes. It needs to be treated as a mental illness with therapy and sometimes medication. Therapy and counseling are the best forms of dealing with this disorder. Since, in most cases, the primordial cause of IED is trauma, professionals use therapy to help the patient deal with past trauma and help them overcome their current situation. There can also be additional ways of self-treatment, but professionals recommend these to be used in addition to professional treatment. These include: change any environment that could contribute to anger or a lack of self-control. Practice relaxation techniques and problem solving. Avoid any use of substances. And improve communication and connections to others. However, multiple people see themselves as unable to seek treatment because of the repercussions of social and self-stigma. Specialists who are unaware of this condition or do not believe in it can easily mistake it for a common anger management problem, and send the patients to find help, which can be not as effective. Since the majority of individuals with this disorder are male, it can be easily excused as common male anger, which increases the probability of many men being undiagnosed because they are unaware they even have a problem. This can be very dangerous because, in the long run, this disorder can lead to isolation and the decay of relationships because of the shame of being unable to control their emotions, or the deterioration in their relationships. That is why the initiative would consist of an Instagram campaign with a hashtag and the main account to process all the information. With the hashtag IED is real, we would encourage people with this disorder to share their experiences with the public. This information could range from their positive experiences seeking help and getting better to any negative story of how stigma prevented them from doing so. The hashtag would be a way to reduce the stigma surrounding IED and allow people to be more open about seeking help. Additionally, there will also be the main account that makes regular posts with crucial information regarding IED and how to seek professional treatment. Each post would include different data and links to studies and counseling for the people searching for extra information. By partnering with some counseling clinics and companies such as ThriveWorks, it is possible to direct people to seek the professional help they need through links to the main page. Our primary goal would be to get as many people as possible to participate and see the shared information, to reduce the stigma and allow people to continue their lives as best as possible. We encourage everyone to share this information with their close ones in order to spread the word and raise awareness. If you know anyone who may suffer from intermittent explosive disorder or suffer from similar symptoms, please advise them to seek any professional opinion and help as they deem necessary. Thank you so much for your time.